I am really glad to welcome on stage Stéphane Nègre and Patrice Cristofini from Orange and Intel. So, Stéphane, we'll have a population a little bit older than we are today in 5 years, and chronic disease is going to be that way. I mean, everybody is going to plug ourselves and be monitored constantly, and we'll have to call our care devices.
I mean, you are right. So aging population, in fact, is good news. So this means that we will live longer, and so this is the positive view of it, and the technology will help us not only live longer, but in better comfort. So at Integ, we are developing technology for years around telehealth. So this is the ability to monitor patients when you wake up in the morning and you take your smoke injection, etc. So this is important, but from a patient and from health professional perspective, this is really something that will help make tremendous progress in the way people are cared. So telehealth is allowing, and Professor Shapiro, Mr. Shapiro was saying about the fact that telehealth will allow people to live more independent, so with the ability to stay at home or instead of going to the hospital and to be monitored. So in fact, this is already a huge benefit of the technologies. At Integ, we have developed a series of technologies that are demonstrated in the showroom. One is what we call the Telehealth Guide. So this is a device you have at home, connected to sensors. So you may wear some of the sensors, or you may use the sensors, as in the video when you wake up in the morning, and the professionals are connected to this device you have at home, and they will adjust your medicine. They will adjust the care treatment more or less real time. So this is really for the professional being able to real time monitor the patient if wherever they are, and hopefully at home and not in the hospital. So this is huge benefit. So we have many technologies that we will start to pilot together with Orange in the Auvergne region. For those who are not French, Auvergne is more or less in the center of France, pretty remote regions. So those technology will be really demonstrated, and we show all the benefits. So benefits are at least threefold of such technologies. I mean, we have seen the benefit for the patient. So being able to stay at home, to stay with the family is really something that is important. For the professional as well, is to have access or to share patient records is something important in order to adapt the medicine, adapt the care program, and even more important, to prevent emergencies. So we are turning care into instead of being reactive and reacting to emergencies, to prevent emergencies from home. This is really, really important. And finally, I mean, the third benefit, let's say for the institutions, for the government, for the policy person, this allows to have population having access to the best care without going or without the need to concentrate or to have them travel to big cities or to go to the doctors. So this is important, and at the same time it reduces cost pretty significantly because the cost of having such an equipment in the home versus a week or couple of weeks or months of in the hospital is very fragment of it, and providing the best or the same level of medical treatment with best comfort for the patient. So many benefits of using technologies in telehealth or adapting technology for telehealth.
Okay, well, yeah, looks really promising, and I understand that people will stay at home and will be constantly monitored. So in a way, we are becoming like providing data flow to everybody. With a number of things maybe under our skin. So maybe a question for you, Patrice. How do you see future? Because Orange will be providing, loads of data coming from the different patients across the planet. So how do you see things?
So we are very confident in the future. What we think is that behind the concept of eHealth, we have two components. We have medical and social. And in fact, we have a key change of paradigm because now eHealth is the property of the patient. So we think that in the future, patient will decide to manage the own capital santé, the own health capital they have. So in fact, for Orange, our view is how we can help the data, how we can manage the data between the patient, the healthcare professionals, and all the ecosystem involved in the eHealth. We have strong position in hosting, in integration, in consulting, and also in network. But for us, probably the key thing is to be the technical partner for the ecosystem. We don't want to take the choice. It is to the patients and to the healthcare professionals to select the content they want to use in the healthcare sector. But one of our main interrogation is, for us, the technology is probably ready now. We have a lot of technology. The key thing is, what will the ecosystem decide to use? And the second thing is that you can launch marvelous technology if people, citizen or customer don't want to use it. It won't be successful. And just to give you, if you remind Descartes in the Discours de la Méthode said, it's not enough to have a good idea, the main thing is to use it. It's exactly the challenge we have. We know that eHealth solution is complex. We know that we need to build a value chain with partners like Intel, but in fact, the success will be how patients will use it, how will be the acceptance from a sociological point of view.
Right. Thank you very much, Patrice. So that's a key question. And I have in the room here Dr. Florence Grenacia, who could give probably, share your experience as a practitioner. You are at the Paris hospitals, and I remind everybody that the Paris hospitals, Hôpitaux de Paris, is the largest university hospital in Europe. So how do you see that? Do you integrate already these technologies that are coming up, or?
Yes, certainly. Yes, all that you said, I'm in charge of tech transfer, innovation, patents, and research at Assistance Publique Hôpitaux de Paris, which is the first university hospital in Europe and the first sponsor of clinical trial in France behind the laboratories, the company. So we know that what you said, we need innovation, and the innovation are coming from the physician and for the patient, because they think what will be the better way to healthcare and to take care of people at home, as you said, because the healthcare at home is one of the activity of the hospitals in France. So we need to work with these companies that they have the new technologies to provide new services to our patients, because in hospitals in France we have a high level of quality of science, of research, but we need to have too the innovation and the tools to give to the people that come in our hospitals the best services, because now in France, hospitals and public hospitals must give the best services to their patients. So yes, certainly we are involved in all these experiences, in these research collaborations, that we have collaboration agreements with those companies and others in this place today. So yes, we are certainly involved in all this best way to healthcare people.
Yeah. Okay. Thank you very much. Well, thank you, gentlemen. So we'll see that in 5 years' time, just like Gary put it, and we'll see whether the bet is the right one and who decided to use what in the end. Thank you very much.
Thank you.
Thank you.